Senator Durbin.
Thank you, Madam Chairman. And Dr. Schuchat, let me join the chorus. Thank you for 33 years of remarkable service. I have a question for you in a minute, but I want to start with a little different approach. And let me say that I think this pandemic has not broken us, but it has taught us where our system is broken. And there are many areas we need to look at seriously. If you took a look at the public health scorecard and try to find an objective measure, the one that I return to frequently is the fact that the United States has less than 5% of the world's population, yet 20% of the COVID-19 infections and deaths. And that tells us we can improve dramatically. Where did we shine in this effort? Certainly vaccines. The quick response, as we learned again this week in a visit to NIH, was because we were prepared and we had the science ready, and we had good fortune in identifying the culprit and in devising an effective strategy to go after it with vaccines. I would also add that the Warp Speed program appears to have dedicated and invested funds in a dramatic way at a time when it was very important. And I think that accelerated the availability of the vaccines, and I give the Biden administration credit for administering them and distributing. So those are the positive sides. But one of the messages that I learned out at NIH was, now let's get honest about this. We not only have to bring this pandemic to an end, we have to prepare for the next pandemic, which may be 5 years away or 15 years away. We don't know. But history tells us there will be another one. And the question is, will we be ready for it? The CDC is going to play a critical role in this. And the first question I have to ask is to Dr. Schuchat. After 33 years of observing this agency and its role in the American scene when it comes to public health, there's a fear that it has been politicized in the last 4 years or maybe even before, and that now public health issues are so political. When the division on whether to get a vaccine or a vaccination or not seems to break out on party lines and political lines, we've reached a new stage. What is your thinking, and having observed and worked with the CDC all these years, about this politicization, if that's the word, of public health?
Thank you so much for your comments and your question. The viruses don't vote, and the pandemic has really told us that everyone is vulnerable, everyone in America, everyone around the world. And CDC is a science-based agency, and we lead from science. We're data-driven, and we work together with state and local partners who reflect the values of their communities. So I think that focusing on the science and the service mission of the agency is what we need to do.
Have you noticed any recent change in terms of the political image of CDC, which tries to be apolitical?
You know, this pandemic has been so difficult for the nation, I think for all of us in public health and certainly for our colleagues around the world. The messaging has really been difficult, very conflicting messages that left Americans confused. And so I think we're committed to clear, honest communication of what we know and what we don't know and what we recommend people do. So I do think the messaging environment this past pandemic has been really tough.
I would agree with that. Dr. Walensky, I'm worried about gun violence. I believe it is a public health issue because I represent the state of Illinois and the city of Chicago. And we have the equivalent of a mass shooting every weekend in Chicago. It is a disaster in terms of its impact on the lives of many people and the life of the city. You have a proposal to make a $100 million investment through the CDC in community-based violence intervention, working with neighborhood organizations and hospitals to deliver services. I commend to you a program which we've started in Chicago called the HEAL Initiative. I'll send you some information on it. But I'd like for you to say a few words about what you anticipate that $100 million is going to be used for.
Thank you, Senator. Our intent here is to look for areas in high violence cities where we can accumulate data, we can get accurate information, where we have actionable interventions to prevent all areas of violence, community violence, domestic violence, suicide, to increase public health using those resources in areas that have been highly impacted. We want actionable interventions for prevention.
Thank you. Madam Chair, I would just say in closing, you're in a unique position being on the Authorizing and Appropriating Committee. But one element I hope we don't overlook, and I know you feel sensitive to this as I do, is the need in schools to have access to counselors, mental health counselors, and maybe traditional school nurses, so that any public health effort, which should focus first on our children, has the wherewithal to do that effectively. I find that we have allowed that to lapse in many areas of my state.
Thank you, Senator Durbin.